This next story reminds us that it's not always that elites don't care that the average American can't always afford healthcare or housing payments or food. Sometimes they may not know what's going on. And as some of you may know, Donald Trump's lawyer, Rudy Giuliani, has been hospitalized with COVID for a few days. Rudy behaved completely irresponsibly for the last month. He's been flying around the country, doing indoor so-called voter fraud hearings, no mask. So he caught the virus. Trump lawyer Jenna Ellis also caught the virus. Rudy was reportedly convinced by Donald Trump's doctor, Sean Conley, go to the hospital, just go. Because reportedly, Sean Conley said to Rudy, we can deal with this in 3 days and then you'll be good to go. And then from the hospital earlier this week, Rudy was speaking out against masks and social distancing guidelines. I mean, the irony, while he's in a hospital getting treatment. And we later found out Rudy Giuliani received remdesivir and dexamethasone as treatment. Rudy was interviewed on New York talk radio station 77 WABC. And he said, listen, we have treatments. This is okay. Listen, they give you medications and you improve. Let's not overreact. Let's not go crazy with masks and social distancing. And when the host pointed out, the protocol you've received, in particular remdesivir, except in certain cases where you qualify for it without paying, that's too expensive for most Americans. Every American can't get remdesivir. And Rudy said, well, I don't know. I mean, they gave it to me here at this hospital. And he said, I don't know that it's true that not everybody can get this. When Trump came out of coronavirus, he was also saying, these are quotes, don't be afraid of it. Don't let it dominate your life. We have treatments. It might even be a cure. And of course, Donald Trump received dexamethasone for low oxygen, which is not expensive. But again, you have to be in a place where you're being monitored very closely, where as soon as you get low oxygen, you get the dex. He got 5 days of remdesivir. Trump got the experimental antibody treatment from Regeneron. This is not available to all patients. It's available to rich and or privileged patients or celebrity patients. So Rudy is thinking, I don't know, I got this. I just went to the hospital. I've got a 3-doctor team monitoring me and the top treatments. What's the big deal? And this is exactly the point. People connected to reality understand that this is a 2-tiered system in the United States. Now, Rudy did say he doesn't think he would even have gone to the hospital this soon were he not well known or a celebrity. So in that same interview, he seemed to recognize, I think I'm here because I'm a celebrity. I don't know that I would even be here. But he's unaware of the fact that even when hospitalized, not everybody can get the treatment that he got. And this is the reality. American healthcare is really good for the privileged and the wealthy. People even come from other countries here to get specific treatments or procedures. Even for people living in one part of the country versus another, it can be a significantly better healthcare system. But for huge swaths of the population, it's a disastrous system. At the same time, Rudy acknowledges he's there because he's a celebrity, but he seems to think anybody would get the treatment. Most people are told stay home. If it gets really bad, come in. When you go in, it's packed, and you have one doctor for 20 patients rather than 3 doctors for one celebrity patient. Now, it's quite possible that even if Rudy Giuliani knew that not everybody could get the same treatment, he still might not have a different perspective on what should be done. But this is like the height of plutocracy. It's less that, I have no problem with Rudy getting what he's getting. It's that everybody should be able to get it, and they can't. Remdesivir, it would even be a dosing issue. I mean, there's not that much of it available. And Rudy seems completely clueless about that piece of it. Folks like Rudy don't understand what these things cost, whether the average American can afford it. Think back to my appendectomy last year. I have insurance with a $2,000 annual deductible for hospitalization, large procedures, ER, that type of thing. So when I went in, not even knowing yet that I had appendicitis, but suspecting it, I knew I could be responsible for up to $2,000. I could come out hours later and owe $2,000. And when they started with the CT scan and the IV drips and then said, you have appendicitis, you're having surgery, I anticipated I'm going to owe $2,000 here. Now, I always have in my mind, I have a $2,000 deductible at any time. I fall and break an ankle or I get to whatever. I could owe $2,000. I have the $2,000. It's okay. I had the privilege of knowing, you know what? I'll go to a top hospital, Brigham and Women's, have a great surgeon, great care, and then I'll owe $2,000 and then I'll pay for it. And that's great. Half the country can't meet an unexpected $400 expense. With insurance, they would not be able to meet the deductible. And my deductible isn't even that high. Lots of folks with high deductible plans might have a $4,000, $5,000, $6,000 or $7,000 deductible to meet before their insurance kicks in. And meanwhile, Rudy thinks you show up, they give you the Dex, they give you remdesivir, 3 doctors are checking in on me, and it's all really, really great. This is part of the problem. A lot of the people claiming it's no big deal are the people who have access to that at the drop of a pin. You may not have known this, but when you see me sitting here on the show, I am often wearing shirts by a company called Teddy Stratford. I asked them to be a sponsor because they are by far my favorite shirts that I own. With almost all other slim fit button-up shirts I've worn, you get this annoying stretched out gap in the chest where the buttons are, which does not look good. But what makes Teddy Stratford shirts unique is this patented zipper that's hidden underneath the buttons, which actually prevents the chest from looking weird and stretched out like that. It looks really good. And just all around, they cut the entire shirt in a specific way that makes your upper body look a lot better. It's just a much nicer and more stylish fit than you get from other shirts. And they hand make everything with 100% Egyptian cotton and flat felled seams, which means it's going to be a lot more durable than other shirts and last a lot longer, which I really love. Go check them out at davidpakman.com/Teddy. The link is down below and they'll give you 15% off your first order if you use the coupon code PAKMAN at checkout.